couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. In general, according to the RAND Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. One of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition.
Robert F. Kennedy Jr. claimed Americans are paying the lowest prices in the world for prescription drugs. Bernie Sanders immediately called that claim absurd, then pulled out a cancer drug comparison that put Kennedy on the defensive.
A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
For those drugs, we do.
I'm sorry?
For those drugs, we do, Senator.
Well, for certain drugs. But in general, would you agree with the RAND Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common drugs.
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
For the most common drugs, we do. Or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, that claim has faced a major reality check since this hearing. By August 2026, U.S. prescription drug prices had fallen 3.1% year over year, the biggest annual decline in more than 60 years. But experts say the drop cannot be credited to Trump RX alone. Generic competition and Medicare negotiations are also major factors.
Let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the RAND Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right.
Since this exchange, Trump RX has expanded dramatically. On May 18th, the administration added more than 600 generic medications to the site, allowing consumers to compare cash prices with local pharmacies and other discount programs. But the broader question Sanders raised, whether Americans are actually paying the lowest prices across the entire drug market, remains disputed.
Let me ask you another question. We're on the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but We are now regulating it for the first time, and you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on
Yes.
prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
U.S. prescription drug prices have fallen 0.8% in July and are down 3.1% from a year earlier, the largest annual decline since 1963. The Trump administration has credited its most favored nation pricing agreements and Trump RX for helping drive the decline. But that does not prove Kennedy's broader claim that Americans now pay the lowest prescription drug prices in the world. Independent analysts say the decline has multiple causes, including the arrival of cheaper generic and biosimilar drugs and the Medicare drug price negotiations created by the 2022 Inflation Reduction Act, which took effect this year for the first 10 negotiated drugs. Experts say it is still difficult to determine how much of the overall decline is directly attributable to Trump RX or the administration's MFN agreements. And there is an important reality check sitting directly on TrumpRx's own website. The site currently advertises itself as offering the lowest prices, but its own comparison pages can still show situations where the U.S. price is substantially above an international reference price. For example, one current TrumpRx listing shows Gonal-F at $1,450 per pen in the U.S. compared with $310 as the Germany global reference price. That makes Sanders' original challenge much more interesting in hindsight. When Sanders confronted Kennedy, he wasn't disputing that some individual drugs could become cheaper. His argument was about the much broader statement that Americans generally pay the lowest prescription drug prices in the world. Kennedy eventually acknowledged an important limitation. Many drugs were not yet covered by the administration's agreements, while maintaining that the drugs covered by the deals were receiving much lower prices. Since then, Trump RX has expanded beyond its initial group of branded medications and now includes a much broader selection of generic drugs. The administration argues that the expansion gives consumers another way to access lower cash prices. But the political fight has continued. On August 13, 2026, Senator Elizabeth Warren sent Kennedy a follow-up letter challenging the administration's pharmaceutical deals and asking for more information about the savings being claimed. Warren argued that some branded medications available through TrumpRx already have cheaper generic alternatives elsewhere, even though the TrumpRx platform has expanded its generic offerings. So there's now a genuine tension in the evidence. The administration can point to an extraordinary 3.1% year-over-year decline in prescription drug prices. That is real and significant. But critics can reasonably ask whether TrumpRx and the MFN deals deserve all the credit, because the decline is also being affected by generic competition, biosimilars, Medicare negotiations, and changes in the pharmaceutical market. And that brings us back to Sanders' exchange with Kennedy. Sanders was trying to establish a simple principle. If Americans are paying more than people in Europe or Canada for the same medicine, why should they? Kennedy agreed with the basic concept and said the administration wanted to codify lower international prices. Sanders then said he planned to offer legislation to prevent Americans from paying more than comparable countries. The subsequent numbers make the argument harder to dismiss. Prescription drug prices really are moving downward in 2026. But falling prices are not automatically the same thing as America having the lowest prices in the world. There is another important distinction. The federal prescription drug CPI measures changes in prices across the market. It does not necessarily tell an individual patient what they personally paid at the pharmacy. Insurance coverage, deductibles, co-payments, formularies, manufacturer discounts, and whether someone uses a generic can dramatically change the final amount a patient pays. Analysts therefore caution that the nationwide price decline does not necessarily mean every American is experiencing the same level of savings. That is why the April hearing remains relevant months later. Sanders was challenging the scope of Kennedy's claim. Kennedy was defending the results of specific pricing agreements. Those are not necessarily contradictory positions. If TrumpRx and the MFN agreements are genuinely lowering prices on covered medications, Kennedy has evidence that the administration's strategy is producing results. But if the administration uses those results to claim that America as a whole now has the world's lowest prescription drug prices, Sanders has a much stronger argument that the evidence does not yet establish that conclusion. The latest developments also raise a bigger question about what happens next. If drug prices continue falling through the rest of 2026, the administration will have a stronger case that its policies are contributing to a structural change in pharmaceutical pricing. But if the decline is primarily driven by generic competition, Medicare negotiations, and other market forces, then the administration's claim of responsibility becomes much harder to sustain. And there is still another test. What happens to patients' actual out-of-pocket costs? A lower national drug price index is encouraging, but the real political test is whether Americans actually walk into pharmacies and pay less for the medications they need. So the biggest takeaway from the Sanders-Kennedy confrontation is no longer simply who is right about drug prices. The better question is, are Trump's MFN agreements and TrumpRx genuinely responsible for making prescription drugs cheaper for ordinary Americans, or are they taking credit for a much broader decline caused by several different forces? And as of August 19, 2026, the evidence shows that prescription drug prices really are falling dramatically. But it is still too early to say that the United States now universally pays the lowest drug prices in the world. What do you think? Is the administration finally delivering the drug price reductions Americans were promised? Or is Sanders right that the lowest prices in the world claim goes much further than the evidence supports?